Did you ever consider that type 2 diabetes is preventable and in most cases it's actually reversible? Well, tune in every Friday at noon for our 15-minute live sessions where we bust the myth that you don't have control over your type 2 diabetes.
Type 2 diabetes is completely preventable by making simple but powerful lifestyle changes without drugs or surgery. Yes, we said it, and Friday at 12 we'll keep saying it. Plus, we will give you the evidence and the practical steps to take control of your type 2 diabetes.
I'm Dr. Lynne, emergency medicine physician, and I'm here with my lovely co-hosts, Dr. Erica, GP from the West Midlands, and we are both lifestyle medicine physicians. And we are here with Lynne, lifestyle medicine nurse and registered nurse in the NHS. And we are here with our dietitian, Petya, who is also the lead diabetes lead in the NHS. So today we are going to be speaking about the cause of type 2 diabetes. And Dr. Erica, could you highlight what is causing type 2 diabetes and maybe have a look into what is the diet that we are promoting for our patients nowadays?
So yes, type 2 diabetes is generally thought of or traditionally thought of as a sugar disease. But it's actually a lot more complicated than that. And rather than sugar being the problem, there's actually too much fat that is the problem. It's actually caused by something called insulin resistance. Insulin is a hormone that has many roles. It's produced by our pancreas, and it's one of its key role is actually to signal to cells all over our body to take up glucose, which is the sugar molecule, from our bloodstream inside the cells so that the cell can store it for energy in the future, store it, or to break it down and utilize it as energy. And insulin resistance happens when we have too much fat accumulation in cells that are not designed to store fat. And this happens throughout all our body, everywhere, but most noticeably in our liver, in our muscles, and eventually also in our pancreas. So I want you to imagine a kitchen sink and the drain being clogged up by fat. And when we turn on the tap, that is sugary water flowing through. And when we have a drain that is clogged up by the fat, just like in our cells, when we turn the sink on with the sugary water, it's not able to flow through. And so the kitchen sink ends up being filled up with this sugary water, just as our bloodstream is being filled up with sugar. And one of the commonly recommended diet for our patients with type 2 diabetes is a low carb diet, and it's very popular. And if we kind of apply that into our kitchen sink scenario, without clearing this clogged fat, we're simply turning down or turning off the tap so that the sink is no longer being filled up with this sugary water. But this problem of insulin resistance, the clogged fat, still hasn't been resolved. So the underlying root cause of the excess fat clogging up the cells, causing insulin resistance, remains there, even though our blood sugar level is not rising because we're no longer turning that tap on full.
Petya, what is a low carb diet?
So there's many definitions that are used, but generally what we think of as a low carb diet is a diet which limits carbohydrates to about 130 grams per day. This means that you'll be having about 30 to 40 grams in every meal. And just to make that a little bit more understandable, because we don't I don't count my carbohydrates. I don't think most people do. But if you look at your plate, if only about a quarter of it is full of starchy foods like potatoes, rice, pasta, that will be about 30 to 40 grams of carbohydrates. And that is often recommended to people with diabetes. The idea is that it's carbohydrates which break down into glucose, also commonly referred to as sugar. And yeah, as Erica said, when you're having a lot more sugar in your blood, then if your sink is clogged up, then it will be building up. The main problem with the low carbohydrate diet, I think, is that it's quite difficult to stick to, because glucose or sugar is your body's preferred fuel. That's your petrol, and that's what you run on. So it is, in the long run, I think most people can stick with it for maybe 3 or 4 months, but in the long run, it is difficult to stick to. To be fair to low carb diets, when we look at the results, while people are sticking to the diet, they do reduce blood sugar levels. As we mentioned with the sink analogy, there's less sugar coming in, so the sink is not getting overfilled, even if it's still clogged up. But that's in a way quite short-sighted. So we're just focusing on one measure, which is thinking about blood sugars, and that's the only thing we care about. But when we look at large population studies, people who follow a low carbohydrate diet, they tend to get more chronic disease and they tend to die earlier as well. So when we look at the bigger picture, low carb diets don't look so good. And one of the biggest issues, I think, for me with just recommending a low carb diet is that there is usually no distinction made between the types of carbohydrates, which we'll explore in one of our future Friday sessions. Sorry, just to wrap it up, essentially 130 grams of carbohydrates will be about 25% of your calories, depending on how many calories you eat, obviously. But if only 25% are coming from carbohydrates, that means that the majority are coming from protein and fat, which we know is not really helpful.
And to just focus in for a minute on the carbohydrate story, when we are suggesting to our patients to go low carb, do we clearly define to them what is a carbohydrate that comes from a whole food, that nature intended the food to be whole, like an apple, grains, beans, and legumes, and those carbohydrates which actually come from processed foods? Do we make it clear to our patients?
I think most of the time, from what I've seen, with patients coming in to see me, that distinction hasn't been made clear to them. I don't think many healthcare professionals are clear about that distinction. We kind of simplify it to say that, well, all carbohydrates break down into glucose, which is true. But yeah, it is just another level that we need to add to say that when it is fresh unpackaged food that comes with a lot of fiber and plant phytonutrients, then that sugar, even though the carbohydrate breaks down into sugar, the body handles it differently. It's not absorbed as quickly. It doesn't lead to that big sugar spike. So your body is not just a machine that you input carbohydrate, it spits out sugar. There is a lot of different processes, a lot of impact on your hormones. So it's really important to distinguish between processed carbohydrates and fresh unpackaged whole carbohydrates.
And to touch on the distinction, we must talk for a sentence about fiber. What is fiber doing in this equation?
So essentially, I think of fiber as the skeleton of plants. So it's kind of that roughage. And what fiber does when you eat it, we often say, oh, it makes you fuller for longer. And while that's true, it fills you up with something which is low in calories, which can then be helpful for managing your weight. It also slows down the rate at which your stomach empties, which then means that any carbohydrates which are in your stomach will enter your bloodstream more slowly. So that will prevent any big big spikes in your blood sugar. And it also means that you won't be overwhelming your liver and your muscles with a lot of sugar coming in at the same time. So fiber helps to give you a steady supply of your fuel of glucose.
Plus, it also helps to absorb the cholesterol in the gut, which is really beneficial. But now you both mentioned, Dr. Erica and Petya, that we are looking at a low carb diet where the patient is now thinking, so what should I be eating? And very often, as you mentioned, they eat a lot of saturated fats through chicken, eggs, and that is one of the main sources in the Western world of how we fuel ourselves. So if I can eat carbs, well, then I'm going to have to eat a lot of protein from meats. And Lynne, what is the actual protocol for mice in labs to increase their insulin resistance?
This is quite a scary fact, Linda, but basically to create insulin resistance in our lab mice, they feed them a high fat, low carb diet. So basically they are telling or giving the mice the foods that we are recommending to patients to eat to prevent or reduce their insulin resistance. So it's a bit of a mixed message. What we're telling our patients to do is actually what we are doing to induce diabetes or insulin resistance in mice.
Well, that's telling quite a lot, isn't it? So there's quite a lot that we will have to address in these Friday series. We are going to have to learn how to eat a high carb but whole food plant-based diet, which also has its fats but in a lower quantity. So that's what we are going to be addressing in our future episodes.
Can I just add one thing here, Linda? Just about the low carb diet, and if you imagine again the kitchen sink scenario with or without, actually when we tell our patients to eat a low carb diet, as Petya say, we're measuring just one measures the blood glucose, which is a symptom of diabetes and not the root cause of diabetes. We're still not addressing that root cause of insulin resistance. So when we eat a low carb diet, we're simply treating the symptoms and not the cause.
Exactly. And we're going to have to look at how we are going to be able to clear that sink of all that fat and clogs so that we can actually drain down the glucose into the cells that need it for energy. And we're going to talk a little bit more about that in our next episodes. So
I'm a bit confused. What can I eat then?
Well, what you can eat is, and we can actually demonstrate it by dividing your plate into 4 of us. And I would be saying that you can eat legumes, beans, and lovely, here you go, lentils, which is your protein source. And Lynne, what else can they eat?
They can eat, and they've not to be scared of eating, lots of fruit. So apples, berries, whatever, grapes, oranges, bananas. Don't be scared. They're okay to eat.
Erica, what else can they eat on their plate if they cannot eat all of that saturated fat?
So whole grains, what are whole grains? It confuses so many people. And I have got here some rolled oats for breakfast. It's great. And I've got some quinoa, and one of my favorites, a massive bag of bulgur wheats as well.
And Petya, what else can they eat?
And of course, everyone knows that you should be eating your veggies. So I've got a nice few yellow bell peppers with me that nicely match my dress. Don't forget to eat your veggies.
It's beautiful. So no, it's not only a lettuce or a salad that you can eat, or nothing, as some of our patients often say when we advise them to eat a whole food plant-based diet as nature intended our foods to be. There's a lot of hearty stews and dishes that you can make out of these 4 components, and we will speak much more about it in the future. So thank you very much, ladies, for another fantastic session. And if you like this session, please do hit the subscribe button and join us live every Friday at noon to learn how you can prevent, treat, and even reverse type 2 diabetes. Thank you very much. Bye.